Welcome to week 38. 38 weeks pregnant, your baby is basically about 7 pounds, could be less, could be more, depending on how big your baby is ultimately going to be, but you're in that 7-pound range now at 38 weeks. At 38 weeks, most women just want the baby out, and I don't blame you because it's pretty uncomfortable at 38 weeks. However, you really don't want to do an elective induction or an elective C-section until 39 weeks. There really is a difference in complication rates for the baby in that week. So you really want to wait till 39 weeks before you do anything electively, even though you're just sick of being pregnant and you're probably pretty miserable. You're probably not sleeping at night, your hips are hurting, lots of aches and pains, maybe cramps in your calves. It's just hard. It's hard to get around with a 7-pound baby sitting in your uterus and still trying to negotiate through life. So I understand that it's hard, but you want to hang in there and finish strong because your baby still has a little bit of developing to do. At 38 weeks, people tend to have more and more swelling, and particularly in their feet or their lower legs, when that tends to get worse by the end of the day. In the morning, that tends to be better, but then there's more swelling in the hands. You want to be careful about your wedding ring. Make sure that it's not stuck. If you're finding your wedding ring is difficult to get off, you want to take it off and keep it off, because what you don't want is for your hands to swell so badly that the ring gets stuck and cuts off circulation to the hands. Every now and then we have to cut off somebody's wedding ring, and we just hate to do that, but it's better to cut the wedding ring off than to cut the finger off. So that's one thing to watch as the swelling gets worse, just to be careful that your ring is able to come off. You want to start watching for signs of labor. You may be experiencing some of those soft signs, bloody show, mucus plug, the baby dropping. None of those are reasons to go to the hospital, but they do mean that your body is starting to do the things that it needs to do to prepare for delivery. When you start having hard contractions every 3 to 5 minutes, or if your water breaks, even if you're not contracting, head on in, it's time to have a baby. 38 weeks, you're close, baby's getting big, and I'm sure mom's getting miserable.
Medtwice.com